Hello, people. Whether you're a patient or a healthcare provider, welcome. This is a Seeker's Method podcast in the making. I'm Dr. Richard Nahas. We're live in Ottawa. And this is Patrick, who's going to help me demonstrate some of the principles that we use to find and release restrictions in fascia. And these knots, these lesions in the body, which can be left over after any injury or trauma or infection that affects tissue, are lesions that medicine doesn't know about. First called interference fields by doctors who practiced neural therapy in Germany in the 1930s. Described as blockages in traditional Chinese medicine, in indigenous healing practices around the world. For whatever reason, an accident of history perhaps, the concept of these lesions as relevant to human health has been missed by modern medicine. And I've made it my life's work as a medical doctor who's studied and practiced and taught integrative medicine for about 20 years now to bring this to healthcare as a historic advance that's really important for science and medicine to validate and for clinical providers to target to get the best results in people. So Patrick is going to demonstrate a very simple stretch that you can sit back and relax and engage in with us. This is a stretch that is intended to be done seated. Most of my work is done with people who have chronic pain, and being able to sit while you practice self-care, while you stretch, is very important for my patients. So you can start by just assessing which side feels more tense to you. If you feel more tension with this hand on the shoulder than with this hand on the shoulder, you let your elbow rest on your chest and hold on like you're hanging from a cliff from your fingertips, whether you grab the edge of your collarbone or you can reach a little further back to the spine of your scapula. Pick the side where you feel the most tightness. That's the side that you're going to need to work. Okay? And this is a great exercise because it really helps reinforce the notion that right and left are connected and that back and front are connected. If you pull with the fingertips forward and you use the shoulder to push back at the same time, you're kind of pulling the fingers and the shoulder apart, creating traction in the long lines of fascia that travel all the way around and that travel across, attaching to the scapula. And maybe just let your elbow rest here. Relax any tension in the wrist. Let the shoulder hang. Okay? Notice if you're carrying tension in the scapulothoracic joints on this side or this side. Okay? Because the arms and the legs attach in three places. They attach at the sacrum, at the sternum, and at the occiput. Back, front, and back, creating lines of tension that travel up and down the spine as you gently twist back and forth. You may notice that you feel a pulling that travels more up in here Or you may feel a pulling that travels more into here and down into the abdomen. Alternatively, you may feel that pulling down into this hip or the other hip. Being aware of what you feel is one piece of this seeker's method. There are 4 pieces of the technique. So we're using movement, breathing in and twisting to create tension, okay? Pulling on the fingers, pulling on the scapula, exhale and release. Movement, breathe in and stretch, okay? Creates tension. Inhale and exhale to release. Okay? Extends that line of tension to the diaphragm, where all of these myofascial chains actually attach. From the arms to the diaphragm, from the legs to the diaphragm. Yeah. If you need a break, okay, you can keep your hand where it is and just rest your elbow on the opposite side. Okay? That gives those fingers a break. And that's a good lesson, right? So Patrick is feeling some tension in the fingers and in the wrist, yeah? So hang again. Let the fingertips rest where they rest, okay? And you can take that arm down. Pull with the fingers, okay? And now use this hand to find where you feel that tension. Yeah, maybe right around there. Okay? If you feel it traveling in another direction, use your fingers to assess and just kind of hang out where you feel the most noise. Yeah? Are you aware of that? Okay. So now breathe in and twist. Pull on the shoulder, pull on the fingers. Breathe out, release. Very good. Okay, and swaying back and forth in between the repetitions. Try to keep your fingers hanging, and if you need to support them, use your hand. Okay? And now you've released the tension in your wrist. You may feel it somewhere else along that chain. Where has it gone?
So there's some right here.
Very good. Okay, so swaying back and forth, getting ready to do the next breath. Okay, breathe in and twist. Breathe out, release. Okay? So movement and breath, touch and awareness are the 4 ingredients. All you have to do from one breath to the next is find the tension and adjust your posture, one joint at a time, to see how that changes the tension that you feel. Up and down, up and down. Okay. Hang again. Breathe in and twist. Adjust the wrist. Does that make a difference?
Yeah.
Okay. Does the tension move? Follow the tension with your fingers until you find the spot that makes you feel the most supported. Okay. With practice, anyone can learn to feel tension. And right there, perfect. So you imagine a long chain of fascia that travels from the fingertips to the elbow. Of course, it extends past the elbow, but imagining that rope pulling from here to here and all the way through. Breathing in, creating tension on that rope, feeling that tension in your arm, adjusting your elbow now to maximize the tension, and exhale and release the tension, swaying back and forth. Okay. When you yawn, that's a release of tension in your diaphragm. When you feel a sensation traveling through your body and pulling somewhere else, that's a release. And when you feel like this might not be the best place for your hand to rest, see where it feels more stable. So you might find that it's more comfortable to hang there. Yeah? And that's because there's tension between here and here that has now become the place where tissues get stuck during movement. So now repeating the exercise, hanging off that shoulder, relaxing the wrist, relaxing the elbow and the shoulder. And now this time, adjusting the hips. Yeah, tilt your shoulders back and forth and notice how that changes the sensation on one side versus the other. And as you go through the range from one side to the other, try to find the angle that gets stuck, where you feel like a sharpness or a pulling, where it feels like there's a knot. Your goal is not to get to the end of the range, but now that you've found it, put your hand where you feel the tension. If you feel that in your neck, yeah, you can take this hand and you can reach over here. Okay? This is not easy for everyone to do, but with practice, this hugging yourself becomes a very comforting stretch. Very safe, very difficult to hurt yourself in that position. When the areas that are in spasm, because tissues are stuck together, are supported by touch, bringing awareness to the messages created by the nerve endings in that area, it allows you to breathe in. Okay. Create tension from the fingertips to the neck. Yeah, that's the chain that is pulling right now, all the way through there. And release. And swaying back and forth. Yeah. So that would be a scalene. And now you've got your finger hanging off the clavicle, don't you? Yeah. Is that where it wants to be? You feel more supported there?
Yeah.
Now you've got better range of motion. So if I slide your hand up and down here, okay, maybe you can be aware that the other end of the clavicle now wants some support. Yeah. Because the clavicle starts here and ends right here at the AC joint. Yeah. Does that feel more comfortable?
Yeah, that's all right.
Okay. So now try again. Pull your fingers in one direction and pull your shoulder in the other. And twist, create tension. Exhale and release. And sway. Back and forth. And as you're swaying, reposition your hand. See where you need support. Okay. Adjust your wrist. Adjust your elbow. Adjust your shoulder. Okay. And now you're ready for another stretch. Breathe in and twist. Breathe out, release. Excellent. Feeling it in the armpit?
Yeah, there's this whole area here.
Okay, so you can support yourself in the arm. Okay, you can support yourself above the arm, and you can also support yourself below the arm. Okay, so now with your fingertips, you can slide underneath where the scapula attaches to the rib cage, where you have the serratus anterior, the teres major, the tricep, the subscapularis. You can either poke around in here on the chest wall, or you can poke around on the inside of the humerus, or you can poke around inside the chest wall where the pec major is at the front, or where the lat dorsi is at the back. wherever you find the point of tension, you just hold that spot. You don't need to press it. You don't need to squeeze it. You're not doing anything mechanical with your fingers. You're just using light touch to allow you to focus your mind on that point so that you can feel the line of tension inside, traveling from here all the way probably to about here. Okay? So grab your scapula, find the point that feels the most stable. Very good. Now you feel that line of tension from here into here. You can pull the fingers and the shoulder apart. Breathe in and twist. Breathe out, release. Okay, and letting this wiggle back and forth to release those specific tissues that might be stuck together.
Yeah, that's good.
Okay. This is a very common area for restrictions to affect the arm. If I can have you bring your arm down like this and just rest here. This is a posture that traps the nerves of the brachial plexus in many, many people. Anyone who uses a mouse, uses a keyboard, uses a mouse, uses a phone, is looking at a screen either at desk level or holding something in their lap, this forward hunched posture entraps the nerves that travel from the neck through the axillary groove into the arm. This is called the brachial plexus, and restrictions in this area cause symptoms that we think of as thoracic outlet syndrome. But they're also linked to chronic neck pain, chronic headaches, thoracic pain, and of course, because these channels can attach to the sternum or the occiput or the sacrum from the lat dorsi at the back or from pec major at the front, they can cause low back pain as well. So, do you want to try the other side?
Sure.
Okay, so, hang from the scapula. Okay. Let the fingertips do all the work. Okay. Relax the wrist, relax the elbow, relax the shoulder, and then relax the scapula where it hangs off the rib cage. Bring that up and down if you can. There you go. Adjust the neck back and forth, left and right. Okay. Adjust the hips back and forth. Notice how all of those adjustments change the line of tension that you feel. Mm-hmm. Okay. So hold on to the scapula, pull with the fingers, pull back with the shoulder, and now twist into tension. And release. Noticing where you feel tension, taking your other hand to that spot, sliding up and down. I feel it around my neck. You may feel it in the front of your throat. Is that where you're going?
Yeah.
Very good. So you can just lightly touch that. Always be careful with the front of your neck. There are arteries there, so too much vigorous pressure can make you lightheaded. Especially if you do it on both sides. So just using light touch this time to support the tension that you feel. You can also adjust your neck forward and back. Okay? You can let your chin wag from left to right, okay? Trying to find the angle where the tightness is most noticeable. Trying to stretch that line of tension that you feel from the fingertips through the arm up into the front of the neck where they attach in the cervical spine. Okay? Breathing in and twisting. Feeling that pulling from end to end. Breathe out, release. Patrick was telling me, should I be looking at the camera or should I be looking at you? And I told him to do exactly what he's doing, which is focus all your attention on what's going on inside your body. Don't worry about me. Because imagining a line of tension that explains the direction of pulling that you feel inside your body requires you to have a kind of a kinesthetic sense of where your feelings are coming from. And it requires you to use your hands to confirm what you think you feel, right? You think that you're pulling and your tightness is coming from here. Well, get more specific. Use one finger and show me the exact spot that's the right representation of where that pulling is coming from. And you know you're on the right spot because that feeling changes. Yeah? And you feel that pulling from one end of the rope to the other. Okay? Breathe in and twist. Feel that inside. Imagine the line pulling inside. And release. For those of you who are practitioners, who know what all these parts are that connect to each other, who know the anatomy of the scalenes as they attach to the first and second ribs, and you understand that that fascia is continuous with serratus, which attaches to the scapula and which pulls on the humerus and explains how these structures can have restrictors in them that create tension here through reciprocal movement along a chain. When you know your anatomy and you understand that the lines of fascia reflect the lines of tension in tissue that were described by Chinese medicine thousands of years ago, pointing to the way that qi flows through the body, you understand how modern medicine can bring science to ancient wisdom. Let your fingers hang off your scapula. Adjust your position to find the spot that makes you feel the most supported. Okay? Use your finger muscles. And now with this one, I want you to just explore the fingers themselves. This is an important part of your arm. You may, if you focus, you'll notice that you feel the tension in one finger. Okay? If you take your 4 fingers on one finger, okay? And then slide those 4 fingers across from one knuckle to the next, to the next, to the next. You'll see that there's more tension coming from right there. I can help you feel it because I do this 5 days a week. In fact, closer to 7. And I've been doing this for years. But once you learn where your own knots are, then you don't have to explore from a blank slate ever again. You have a little bit of spasm in some of these muscles in your fingers because of a previous injury to this arm. And when you realize that you have a little knot in here that's affecting your lateral wrist, you'll never not know that again. Okay? So supporting that one spot with a finger, okay? Breathe in and pull. Okay? And notice how that creates a feeling in the wrist. Okay? And you can adjust that feeling with your finger. Okay? And release. Okay? I like that. That little adjustment of the wrist at the end facilitated a release. Okay? Let's try that again. Breathe in and pull. Okay? And notice the difference between this finger and this one and this one and this one. Notice that there's more tension in these two and that comes right to about where your fingers are. Yeah. Notice that when I pull on that, there's a feeling of something stuck, something rubbing underneath. Okay. Exhale and release. Okay. And now with this one, you can adjust like that.
That's the spot.
Uh-huh.
Right there.
Uh-huh. And when we released this, the tension went here, which is where those tendons come from. So now you can either stick to where you feel the tension, or you can always just do a scan and make sure you haven't missed anything. Yeah? The faster, the better. Now, do you feel like you're tighter there, or do you feel like you're tighter there?
I'm tight here. This is more painful.
Okay, so stay there. And adjust your finger position. Again, not pressing deep into tissue, just using light touch to find the spot that feels different. And you'll see the spot that feels the most different isn't necessarily the spot that hurts the most. It's the place that's stuck, not the place that's under the most tension.
It's right here.
Very good. Now you can pull from elbow to fingertips. Breathe in and twist. Breathe out, release. You can see those little fasciculations up in here as that releases. Did you feel that let go? Does that feel looser yet?
Yeah, that let go.
Excellent.
But
Now where are you tight?
now right beside it.
Okay, let me assess from tip to tip. Yeah, right beside it. So that represents one finger and that represents another. Okay, so you feel that pulling right there? Okay, so just touch on that. And imagine your tricep pulling your forearm away from your fingertips. Breathe in and pull. Breathe out, release. Excellent. Okay. And now, using your hand to cradle your elbow, you can see how that takes all the tension off your fingertips. And you imagine that, like from here to here, it's like a swing. Yeah? And you're holding on to the swing from the bottom. And as you pull one direction with your fingers, right? So pull forward with your fingers, okay? And pull back with your shoulder blade. Okay? You certainly feel that in here, but you also feel that from here to here, from back to front, linking the scapula to the sternum. And relax back and forth, because the shoulders are actually attached as a pair, like shoulder pads that rest on top of your rib cage. And the shoulders are attached here, but the rib cage is attached by the scalenes as they travel in through here. So lifting those shoulder pads as you do this next repetition is going to help you remove adhesions that have your scapula and your pec muscles and your lat dorsi stuck to that rib cage. Okay, so we'll add a little twist to this. So shrug the shoulders, okay, pull and twist, breathe out, release, let them hang and sway. Okay. And now playing with that shoulder shrug, going from the top to the bottom before you do any twisting, and noticing which part of that range of motion creates tension, right? It's not necessarily most stuck at the top or the bottom. It's usually stuck somewhere in between. So if you lower, 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 hold it there. You feel that? Now you've got some radiating symptoms into your arms. So that's the line of tension that you want to target. And if you imagine and visualize that going right through, you feel that right about there, don't you?
Yep.
Okay. So you can let this arm hang here, okay? And keep the shoulders shrugged at that height that is the most stuck, yeah? And then with this hand, you can just lightly touch this area, okay? Because that's your thoracic outlet, right there. They call it actually your thoracic inlet. Deep breath in and lift. Breathe out, release. Okay. Feel that change in tension at that spot.
That release something.
Excellent. And now lifting slightly to get to that stuck point again, right there. Okay. Breathe in and twist. Okay. And feel it from here back to here, wrapping around all the way through, and release. Isn't that interesting? Very good. By linking movement and touch, breath and awareness, Patrick was able to use a very simple stretch in the seated position without putting himself at any risk of injury to find the specific places in his anatomy where previous injuries have made his tissues stuck. Slightly sensitized nerves, slightly restricted fascia, acting as little areas of electrical noise that contribute to chronic sympathetic activation, which is the baseline stress levels in our nervous system. Now we know that stress and inflammation are linked to changes in hormones, to changes in thoughts and emotions, and that because you only have one brain which controls all the hardware, all the tissues, all the organs, all the glands, all of these little disturbances in the nervous system don't just act as mechanical restrictions. They act as little hives of electrical noise that disturb the flow of qi in the body, the flow of lymph and fluid, the distribution of tension along myofascial chains, and that this automatically has an impact on the body's ability to heal itself. So for this reason, we're going to be practicing together on a regular basis, bringing this message to the people and the providers who will use this insight for the benefit of everyone. Patrick, put your hand on your shoulder. Okay? Notice how tight you are. Back and forth. Put your hand on the other shoulder. Notice how tight you are. Whichever side feels tighter, keep that hand up. Okay? Let the fingers hang off the shoulder blade. Let the wrist relax. Let the elbow and the shoulder relax. If you need to, you can support yourself with the other hand. The goal with this stretch is traction. Use your fingertips to pull forward. Use your shoulder blade to push back. And feel the line of tension that travels through the arm, across the spine, into the scapula. As you inhale, twist towards your fingers and pull from the fingers. Exhale and release. Imagine a line of tension traveling from the fingers through the arm, and wherever you feel tension, place your other hand. Holding that point, breathe in and pull from the fingers. Feel the tension travel to the point of maximal sensation. And notice how it travels through the rest of you. Exhale, release. swaying back and forth between each breath. Notice how the tension moves. Adjust your wrist to the angle that creates maximal tension. Reposition your fingers. Deep breath and repeat. Pull from the fingers. Pull back from the shoulder. Exhale, release. Using movement and touch, breath and awareness to find and release restrictions in your body. Moving on to the elbow, adjust the position up and down. Notice how the tension shifts position in the arm. Follow it with your fingers wherever you feel the most tension. Very good. Breathe in, pull from the fingers. Pull back from the shoulder. Breathe in and release. Breathe out and release. You've relaxed the wrist, you've relaxed the elbow. Move on to the shoulder. Shift the position slightly up and down. And stop where you feel the glitch, where you feel the pull, the tightness. Adjust your fingers until they're touching that spot and you feel supported. Breathe in, pull your shoulder blade from your fingers. Breathe out, release. Sway. Feel that release as tissues come unstuck. Noticing as you scan from your fingers to your wrist, to your elbow, to your shoulder, to your neck. Wherever you feel the most tension, that's where your hand goes. Just in case it might be in the hip or the other hip or the sternum, make sure you think about those places. When you're ready for your next repetition, breathe in, pull from the fingers, pull back from the shoulder blade, feeling it from where you're touching to the tips of your fingers. Exhale, release. You can repeat this for as many breaths as you like, anytime, anywhere, throughout the day. This is the Seeker's Method.